So, Dr. Fessler, you've helped me with my hearing for quite a while. And when I first came to see you, I just came in because I was hesitant to even take a hearing test. And then I came in for the full hearing test, and there was some paper, and then you also helped describe, some of what all that meant, and then the consequences of not addressing some of those things. And not scary, but just how it makes life better if you can hear. And I did have some problems. And my wife was even saying, why don't I turn the television down? Or I'd be in meetings and I couldn't hear everything that was actually said.
So the importance of a hearing test should start around the age of 55 if you're not noticing any difficulty. You want to get at least a screening done at that time at your primary care's office to make sure that you have a good baseline and you're normal. And then when you get to the age of 65, you want to start getting a full exam done so we can figure out if you're going to be one of those patients who have age-related hearing loss. That tends to start at the age of 65, and the high frequencies do decline, which are responsible for our word understanding, which is why you may have started to notice some difficulty in conversations and was turning the television up to make sure you could hear it, while others may have been able to hear it at a lower volume. That's okay. We have treatments for that. But we don't want to let it wait, or we don't want to wait and let it fester, because the longer you wait, the less successful you're going to be with treatment. The more likelihood it is to decline as well. So, your brain can make sense of sound when it's louder when you start. However, the longer you wait, the more likely your word understanding is to decline. So you might not be as successful with treatment. Additionally, it has some overall effects on the brain when you wait to treat a hearing loss. When you're not hearing well, you compensate by using other cues like reading lips, turning the volume up, or asking for repetition. And when you do that, your brain starts to compensate by pulling from different areas, specifically the memory center, the cognitive center, and your balance center. So when you're not using those areas of the brain appropriately, they start to degrade over time too. So we want to stimulate the brain auditorily so that you have better hearing, better quality of life, and communication abilities. We also want to keep your brain strong for as long as possible. And we can do that hand in hand with treating a hearing loss with hearing aids or other solutions when you're not a candidate for that.